Hello everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Instructor. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Stay on after the webinar and get your Zen on before the holidays with yoga instructor Emma Poole. And with that, I will throw it over to our moderator who joins us from Instructor, Sonal Kathuria.
Hello, and welcome to HLTH webinar on Reimagining Future Care Management. My name is Sonal Kathuria, and I'm a Managing Director in Accenture Health Strategy. And I'm super excited to host a webinar right before the holidays, as I imagine many of you are getting ready to unwind. And I'm even more excited to have this fantastic group of panelists with me, whose backgrounds I think and I believe serve terrific ingredients to go solve this problem. So I'm going to ask, well, you guys are great. You already turned your videos on. So I was going to ask you all to turn your videos, but I can see you all great. Welcome and thank you. And let's begin with some introductions. Chris, let's start with you. Please tell us a little bit about yourself and why you are important for this conversation, and then we'll take it to Vinita and Mike.
Hey, thanks, Sonal. I'm newly joined at Anthem. I'm president of Value-Based Solutions, and so I support building our payment and incentive models across Medicare, Medicaid, and commercial. But even more important are provider collaborations. So how do we create value in partnership with providers? So incentives are good, but really insufficient for creating value. So it's really how do we use our data, our resources, our marketing capabilities to orient our services around how we can improve value for our customers. I'll say one other piece and then turn it over. I don't know that I'm good for the panel per se. I have a checkered past, and we're close to the holidays here, so I'll keep it light. But yeah, I've worked on the provider side, the payer side, built platforms on the tech side, working for large government contractors. And so, when you think about population management or care management, a lot of places like an ACO, when you've seen one, you've seen one. I've seen, hundreds of what's worked and what hasn't on all sides of the fence. So looking forward to today's conversation.
Great. Vinita?
Hi, good morning and good afternoon to those of you on the East Coast. My name is Vinita Lakhani. I'm the Senior Vice President for Health Services at Vida Health. Vida is a venture-backed digital health company based in San Francisco, and we provide virtual care for physical and mental health. Previous to joining Vida, I've been here about 2 years now. I was at Anthem and really kind of steeped in the world of value-based care and have now, I think, like to refer to myself as a reformed payer executive, or I've just maybe escaped the dark side a little bit, and now in a very new world. So excited to be here today and talk to you a little bit about that.
Great. Mike?
Great, thank you. Good afternoon. My name is Mike Fulamini, and let me just start by saying what an honor it is to be part of this panel. A great group of people and making just a huge contribution towards fixing the healthcare crisis. So it's really an honor for me to be here. I lead business development and national expansion for Privia Health. Privia is a physician platform that wraps around for our physician partners technology, tools, and talent to both help them do well in today's world, but also importantly help them transition to a world of value-based care where we can help our doctors be rewarded for driving down costs and improving quality. I, like Chris, have quite a checkered background, having spent time in my career working for hospitals, working for insurance companies, did a stint in big pharma and devices and biotech as well. And now I'm quite pleased to be on the provider side of the business.
Thank you all of you. And nobody's got a checkered past because I did screen all of you all before we picked you as panelists. So again, thank you. So let me start, Chris, with you as a payer executive. What is the biggest challenge facing payer care management at this moment? So when you look at Anthem, your book of business, you started off talking about it like that. What is difficult around care, and what really needs to change?
Yeah, it's a good question. So there's a million things that you could describe as issues and opportunities. I think the primary one is our systems were built to engage members, and using claims information, they're often delayed in our interaction. And I'm an equal opportunity offender, so I'll give an example. When I was at another plan, and in the sort of a little bit younger, we were getting ready to be expecting. And after we actually had my child, we received an email from the plan that said what to do when you're expecting. So it was about 6 months late. And then one of the, I think, most common criticisms that we hear from a lot of providers is your data to get to us and your interventions are too slow. And so I think that one of the opportunities here is, how do we better collaborate with providers so that we can get more real-time information, right information, right insight, delivered at the right time to the right person. So when there's an actionable opportunity to interact with a patient or a member to improve their health or outcomes, that we can deliver on that. I think the second, really, and the biggest opportunity right now is to think about, how do we leapfrog moving where we've tried to think about for the last 10 years to get clinical and claims data and all these sort of things to work together and interact with providers directly, to say the world has changed. I think COVID has introduced a whole new situation where we more than ever, home and community are the most important. And so how do we provide members, consumers, or patients with access to the services and support, not just care, but services that will help them maintain and improve their health, and then if and when they need care, they can access that care conveniently in the comfort of their own home, interacting through virtual means, as well as home delivery and a variety of other things to make accessing this care and support very convenient.
Chris, that's great. Let me go to Mike next. So, when we talk about care management, we're really talking about both how do you engage the consumer or the patient or the member, whatever you want to call them, in their own health, and then how do you align the provider to go take care of them, right? So as a primary care partner, Mike, what is your take on reimagining care management, and what do providers need to take on to do this, especially for the chronic and the elderly? And the question I keep thinking in back of my head is, what is possible for fee-for-service in a fee-for-service setting versus risk? Because we all know, and all of us have been playing this game of when the tipping point is going to occur for value-based care, it hasn't, right? So we may never get to all risk. So we'd love to hear your points of view on that. Mike, you're on mute.
Thank you. So I'll take it from the primary care physician's perspective. And let me actually start by framing this as in economic terms. And what we are trying to do is restore what I call agency to our primary care physicians. Agency is an economic term, meaning that the decisions that you make have a direct impact on the economy that you operate in. So in this case, these local economies, local ecosystems where our primary care doctors have their practice, see their patients. Either wittingly or unwittingly, I think primary care doctors have traded away their agency over the last couple of decades. Wittingly through selling their practice, becoming an employee. Unwittingly simply by putting their head in the sand, and as things around them have consolidated and as innovation has really come to the forefront, I think primary care docs are struggling to keep up. And that's where a company like ours and many others come in terms of trying to return agency in the form of scale and technology, capabilities, alignment with payers. All of these things are important ingredients ultimately to get to the question that you're asking. I agree that depending on the market, we may never see a tipping point of where value-based care or risk transfer becomes the predominant mode of payment. There will always be some level of underlying fee for service. So from our perspective, our physicians tell us that it doesn't matter what the patient, what insurance card they walk in with, they want to provide great quality care. They want to have better information at the point of care for their patients. And so although we do focus around Medicare eligible patients, we also are focused around the full panel for our doctors: commercial, Medicaid, Medicare fee-for-service, Medicare Advantage. And it's really about understanding below that, what products you're in, what contracts you're in with payers, and how do you understand the quality metrics, the gaps, et cetera, that are going to fulfill the promise of value-based care, without ignoring that fee-for-service layer, though, because those patients really make up the majority of our physicians panel. So this is an and. It's working on both at the same time as we continue to grow the percentage of our business that is value-based care.
Yeah, doctors don't look at a consumer or a member or a patient saying this is value-based care, this is fee-for-service, right? At the end of the day, you're using this as a way to enable and transform all primary care. I'll come back to you. I've lots more questions on that one in particular. Vinita, let me get to this. I mean, you again, not checkered past, but terrific past in the sense that you worked at a payer, you were a consulting firm prior to being a payer, and then now you're at this digital health company. So what is your take on reimagination?
Yeah, thanks, Sonal, for the question. I really learned a lot in the transition from being inside of a large payer to now really leading on the digital health front. While inside of the payer, I spent my time in value-based care, and I dug deep on the kinds of efforts that you drive alongside the incentives of value-based care. So it was all about closing care gaps. It was all about going after making sure STAR scores are taken care of. Annual wellness visits were happening. All things that really focused on what happened inside the doctor's office or inside the hospital, and all in the vein of improving quality and lowering the cost of care. And then I had, a personal family health crisis. And I had to ask myself, well, gee, I've committed my life to value-based care. Why isn't the impact of this value-based care showing up, for my family in their time of need? And what I realized is that I think we're missing something in the space of value-based care, and that is there is a universe of care and support that we need to offer that is outside the doctor's office and outside the hospital. And it really has to do with people's day-to-day lives. It's the millions of decisions that we make about health on a day-to-day basis: what foods to eat, how to take the medications to be most effective, how to make sure you can address, intense, anxious thoughts that may be going through your mind. It is a plethora of just physical and mental decisions that we're making every single day as human beings, either consciously or unconsciously. And we really need to lean into that. Those are opportunities to offer care and support when people need it on a day-to-day basis. But we really haven't captured that in the constructs of value-based care because it's all encounter-based. It's based on what happens, in the offices and in the hospital. And so, building on Chris's comments, there is just a tremendous opportunity now to widen our lens and start to encompass care in the day-to-day lives of people, because we have the tools to do it. Not engagement in its original form always kind of depended on some kind of encounter. Even if it was a phone call from a care management nurse inside of a health plan, it was an encounter of sorts. And we have tools today that make it possible not to have to really always rely on synchronous encounters to care and support people. I mean, today they can send texts, they can upload messages, they can track their biometrics with devices, they can track their meals, they can engage in peer support groups on related health needs. There is just a world of engagement that is much broader than the way we've been looking at it all along, that we need to open ourselves up to, so much so that I think it can fit into reimbursement and into value-based care and open up an entirely new chapter on how we engage people.
That makes a lot of sense. Chris, is going to come back to you, and you talked about the need to work with providers so plans have better and more current information to support members. What's the role of other data sources? As you think about it, we all talk about big data. You know, how is Anthem looking at it? How are you thinking about that in terms of the data that you have and the data that you don't have access to, that can improve, you know, care delivery and care coordination?
Yeah, it's a great question. So I'll say it this way. You know, when you've seen one platform, you've seen one platform. There's care management platforms, there is AI ML platforms, there's remote monitoring platforms, there's virtual care platforms. What I feel is that I'm going to talk about both data and platforms. I think number one, part of my past is creating perspective around how we do things in different parts of the industry, including outside. And one of the things I learned at my last job was we ran all air missions for the U.S. Air Force. And while you can say that's a unique situation, it's not like managing patient care or members, think about it this way. When we launch an air mission, I know where the planes are, I know what fuel they have, I know what supplies they have, I know what mission they have, I know where they are in the air, anywhere foreign or domestic. Our standard was to be able to connect in with any system in 72 hours, regardless if we have standards like fire integration that we're working on here. It takes us almost 72 years to do some of those things, as you know, in these markets to be able to change the data flow. A platform to me that's missing, and I think the rise of the platform that we're going to see is the operating platform that sits amongst all of these different things. Because I think we have plenty of insights. I think we're not delivering the insights to the people who need it, when they need it, when there's that impactable moment, whether it's a provider, it's a benefit specialist or a care manager on the phone interacting with a member, or it's the member or the family health manager themselves. What is the insight that can be delivered to them and how do we deliver it? In the military, we know what insight to deliver at the exact right time so that we, avoid conflict. We don't have those same types of systems in healthcare. And I think when about managing individuals from home to home or longitudinal care, as we talk about it, that becomes increasingly important. We want to see what's happening, but also what's not happening so that we can intervene with the right resource at the right time. That requires more data. And while I'd say we have lots of data now, with home and community being the true battleground, I believe, with where we are now for managing and supporting members, consumers, patients, we've got to think about sources of data like social determinants in combination with claims information, in combination with clinical information, but also personal preferences. I mean, for too long, I think one of our biggest opportunities and challenges in care management in general is the ability to engage. And when we work in partnership with providers and we have an opportunity to impact someone's health, we see engagement rates of 90+% in the kinds of programs and services we offer. When a health plan tries to interact with a member or someone's patient directly, without that relationship with the primary care physician, the care team, or the family health manager, we see engagement rates of 20 to 30%. So I think figuring out how we get not just more data, but deliver the insight to the right person at that impactable moment to change something around their health outcome and health behavior, I think is the key going forward.
Very helpful. And, all the high tech, all the MAGs are in healthcare, right? Looking at healthcare, how healthcare could use the platform to deliver deeper, stronger, non-existent stakeholder interactions, whether it's provider, consumer, member, patient, whatever you want to call them, or even other players, right? Innovators. And then also use that to essentially digitize your interactions and essentially connect your legacy applications. So Vanita, I want to go back to you. I mean, you have a digital platform. That's what your firm's sort of ethos is based on. What does it mean? I mean, what does it mean in terms of implementing a digital platform? Because I could think about 100 use cases that a payer or a provider or a patient-focused company could go do. Is that the differentiation? How do you guys look at it?
Well, so I would say this, there is we've invested as an industry a lot in digital platforms, and we've made tremendous progress and lots of interesting innovation out there, but there's still a ton of skepticism, right? And I walked into this also with many of the questions. So is a person really going to engage in an app on their health, right? Are they really going to use it and deliver outcomes in a way that is meaningful and that we can see show up in cost trends? And what I would say is, if COVID-19 has shown anything so far, is that absolutely people will engage in digital platforms. And we've had, I've had the opportunity to really dig into the data to see, how people engage in an app and what they use. And the insights are actually really clear. And that, the data sort of confirms what we've known all along, which is, yes, healthcare is human first and foremost. But what we found is, if you make that human connection, if you establish a therapeutic alliance, as we call it, with the right kind of care professional, whether that be a dietitian or a licensed therapist or a coach, or if you make that therapeutic alliance up front, you can really extend a person's engagement and kick off their journey in such a way that you can engage with them for a long time, both synchronous and asynchronous. In a very, very effective way. And so I think that when we think about digital platforms, the winning platforms that arise here are going to be those that are both human and digital at the same time, that they've really kind of put those two things together. They're not really just taking the offline care that we have and porting them to the virtual world, nor just taking an app and just putting it out there, but really taking the interaction between the human connection you need to make with people, and combining the amplified effect you can get with digital tools, and put those two things together to create a journey for the member. And so that's what I think the platforms need to do. And the other kind of point I would make about platforms is that we don't need to do with the platforms what we've done in the system today, which is we've really fragmented care, right? We've put mental health over in one category. We put, chronic diseases, and they're each, separate and individual categories. We say there's wellness solutions, and then there's, disease management solutions. And actually, if you really look at a single person, they experience all of these things at the same time. They have depression and diabetes at the same time. They need to take care of their wellness while addressing their chronic conditions all at the same time. And we don't need to, in digital, fragment. We really have the ability with the technology to personalize and create one platform that delivers a seamless experience for people, but in a way that doesn't send them in 10 different directions, that it really is kind of whole person care. And we just need to move in that direction and embrace that. And I think that's another kind of determinant of the winning platform that will emerge out of this.
That was excellent, Benita. That made a lot of sense to me. We talked a lot about data and tech, and the jury is still not out how that's going to work. But one point on data, and any of you could react to it. What's become very clear is we used to look at a certain type of data to do care management. It's like, it's got to have a clinical risk. It's got to have X, Y, Z about the patient, and the patient has to be diabetic, and we're going to put them in this queue. But the leading companies, and I don't know, Mike, if you're experiencing that with your primary care cohort, the leading companies have always said it's not just that problem that's happening with a particular patient. It could be other problems that they don't have, they can't get food delivered in their house, or they don't have anybody taking care of them. They're 85 years old and they got CHF, and so on and so forth. So Mike, your reaction to that, primary care doctors don't necessarily look at these things as products and services. At the end of the day, you're saying, I have a set of issues I need to solve for that may or may not impact the care of that patient or the well-being of the patient. So what is your point of view on that?
I think that's exactly right. And what we're trying to do is architect our platform. And by platform, we go way beyond just the technology. Platform to us is the technology, the data, the workflows, the governance, the financial incentives that are all part of that. And we're trying to architect that in a very open way. So even though all of our physicians practice on the same clinical record with the same workflows, we're never going to have access to all of the information we need within our group. And so how do we architect this in such a way that we work with partners in the ecosystem to collect massive amounts of data on our patients so that we do have an understanding of the needs that exist both in the office and outside of the office? And then how do we design products and services that help to intervene appropriately for them? You know, the hard part about being a primary care doctor in this world as we're reimagining, I'll stay in my economic theory mode from my last answer. There's a famous economist that says you cannot be a great economist if you are just an economist. And I think that's true of primary care as we look to the future, that you can't be a great primary care doctor if you're just a primary care doctor. And what I mean is you need to be interdisciplinary. You need to understand consumerism. You need to understand technology. You need to understand payer contracting, medical economics, behavioral psychology, all of these things that primary care doctors didn't necessarily train in, but how do we wrap around all of these other functional domains so that they can be successful in the management of these patient populations now that we have more data on who they are. And that's where I think companies that are represented here on the phone all have a really important role to play. But in the end, I think that it's that physician-patient relationship that is best served to be the focal point of all of this, not exclusive to other stakeholders in the industry that are making a difference, but in the end, that trust. And I think that that's the important point where this comes together for the benefit of the patient.
That's really good. Let me ask a question on the consumer. Let's switch to consumer now, right? We are talking about a lot of things that a payer cares for, a provider cares for, but at the end of the day, none of this works if the consumer themselves are not motivated or engaged to do this. So this question is for any of you. What's your point of view on sort of making sure the consumer can be motivated? And then maybe you don't need to touch all the consumers that are not motivated. If they're going to go eat that apple pie every day, and by the way, it's holidays, we're all guilty of that, and they're diabetic, could you do something because you're a payer or you're a provider or you're a digital health company? Any volunteers? Vanita, Mike, Chris?
Yeah, I'm happy to start. So, we've talked about this, I don't know, Mike and I used to work together for years, this notion of meeting the member where they are, meeting the patient where they are, meeting the consumer where they are. So I think one piece of this is really, as you think about that, how do we actually operationalize that? And, I think in my critique of the biggest challenge and opportunity, for example, in care management, meeting the consumer where they are isn't meeting them after they've already needed support or service in around the home. More self-service options, more things that help manage their health, not simply care. And so if you think about some of the things that our own company's doing and the market's been doing around COVID, look, we've got more people unemployed than ever before. And so what does service, support, and care look like in their world? How do we use the dollars that we have to invest in or underinsured? We've been talking about that for a while, and there's more uninsured people than ever because of employer-sponsored. Most of their coverage came through employer-sponsored plans. So we're seeing on one hand an increase in Medicaid, which actually has some of the home and community-based service benefits, but largely they're lists, right? It's not easy. If I want transportation and if I don't work with someone like Trivia who can actually, or other organizations that have the ability to come pick me up, I've got to find a number on a website or a flyer that was sent to me. How do we make that easy? If I'm using a listening device, to pick any of them, Google or Alexa or the things that we know commonly, not promoting one or the other, I can ask them, how do I get a ride? I can, I can use an app to get the ride and actually have the plan pay for it. But to Mike's point a second ago, the integration of all those things to make it easy. Not only do I need a ride, but I want the health plan to use my benefits to cover it. And I want, on the other end, I want the right service provider to take care of my specific needs. I think those things start to tie together with how do we use platforms to enable our work to be, to be able to use what we know has to happen, to be able to use the data and these services to be brought together. I think that's one piece. I think the second is, health behavior change or behavior change in general is hard. And sometimes it's not about going direct to the consumer. It's about working with their family. Often it's the person that's the most, a family health manager, usually the mom, but not always. But if you think about managing your parents' care, my parents are in their 70s, a nutritionist and a doctor, you'd think that they'd know how to navigate the health system. But because they've been in the health system, it's also a challenge for them. They want to stay away. So often, how do I, help influence my own parents' behavior on what they use and how they get support? And they're not familiar with all these services. And so how do we make it easy? If you didn't grow up in a family like me that has two doctors, they're actually, both my brothers are doctors. My mom's a nutritionist. My dad's an oral surgeon. And even with that, when we had a personal situation, like Vanita talked about a second ago, when my grandmother got sick, we couldn't organize the care and support she needed at home. She fell, had to go to the hospital. We brought her home. We weren't able to interact with the health plan in time to get her care and support at home. So my family was taking care of her. Leg turns black, readmitted again. Then luckily I worked for one of the largest post-acute providers in the country and was able to pull some strings to get her into a bed. And that's not normal. And it also shows that because I have relationships, I could do something that the average person, may not be able to access. We need not have that. We need to be able to have the right service and support be available to the right time. And people need to be able to access those services and use their benefits, whether it's providing service and support, at-home meal delivery, or other kinds of things that are going to support them, especially in COVID, or to access virtual care options. Because if you think about convenience being some of the new quality here, like peace of mind for me is getting an answer. And sometimes that answer is not perfect, but when I'm in pain or my family member's in pain, I just want support now. And waiting, 10 weeks when I've got, can barely walk is a problem. And so the emergency room isn't always the best, source of that. So how do we reorient the system to engage and support people in a self-service way that allows them to use their benefits and access not just care, but support? I think those are a lot of the things that we've got to do to be able to truly meet the consumer where they are. And our whole system was based on face-to-face. We're going to bring you to us, and then we're going to assess you, and then define what we're going to do, and then we're going to send you home. And the reality is we need to bring the infrastructure to them. And I think COVID is really raising what the new normal might be. I think we have to figure out as the vaccines come out, will we be able to maintain this healthy balance between interacting and reaching out and supporting individuals and families and communities? Or are we going to come right back to, nope, the system's already around us and we're going to bring them into our practice, and we're going to bring them into the hospital? I think we've got an opportunity right now to fix that. And I think value-based care is one of the linchpins. I think platforms are, and I think using our data to be able to do outreach to the right individual at the right time to get them the right support is really key. So.
And just to build on that a little bit, Chris, because I really do agree with your comments. And what I'll say, just to add to it, is that we're talking about consumerism and care management kind of in the same topic here. And I think what we're fundamentally really aligning on here is we have to move the concept of, care management from being something that the necessarily the payer owns or the at-risk provider owns to really empowering the consumer. It's about the consumer really taking charge of their own health and their own care. And we want to empower them to do that, right? And so I think that's the real kind of magic of consumerism, is just being able to support people in a way that helps them help themselves. And if there's something else that I've kind of learned as I've transitioned into the world of digital health, is if you really want to work on consumerism, you've got to do it in a way that your life depends on it, right? So as a business, if members engage, we thrive. If members don't engage, we don't thrive. And it's really that, kind of that focused, right? Is, if they engage, that is a win. And we need to be able to define that engagement. And so, whether you're inside the plan or inside an at-risk provider group, or, or even in the situation, the seat that I'm sitting on, I think it just becomes important that you look at consumerism in exactly that way, right? You got to work on it like your life depends on it. And so it's a mindset shift, right? Because we very much kind of look at things again in those encounter-based ways. And what we're really striving for now is longevity in people's engagement in their health. And that's just a different mindset.
There's a question out there. We have lots of great questions coming in, and I'm gleaning on them. And it's around what the primary care clinic of the future is going to look like. But let me expand on that a little bit, coming off the consumer angle. We have not touched on yet the concept of benefits. In care management, we always talked about, let's engage with the consumer, let's, align the consumer into their management of health. Let's go align the provider incentives to do that. We have yet to break in and say, how do you align medical risk with the consumer incentives and the provider incentives? So, any of you all have had, mixed background in terms of payer provider tech and value-based care and technology. What's sort of your feedback on sort of this concept of aligning products, focusing on affordability, and then also if somebody is chronic, give them a chronic care product versus have them go in the same moniker as you may have a millennial who's young and healthy who doesn't even want to buy health insurance. Mike, what about you?
Yeah, I think one of the challenges there, this is maybe more from my insurance days, is just the regulation that exists on the insurance side and the way that products can be designed and common layers of benefits versus customization of benefits. I think we would all love to see more personalization in benefits, and so that it creates the right incentives for the individual based on their unique needs. But I think we're going to be struggling with the regulatory environment on this topic as we go forward. Now, having said that, this has probably been going on 20 years where as members of the health plan, as patients, we are bearing an increasing part of the cost increase, and so it's falling on us through high deductible plans and more and more of it is funded by the individual. Now, the promise has always been, if we can drive transparency, if the consumer, and I think the points that both folks raised are exactly right, if they're engaged, if they have information that they need, they can make better buying decisions. I don't think we've seen a lot of that happening really yet. Maybe on the margins we do, but I think that's going to be one of the big challenges for the industry is how do you engage the consumer, recognizing that a lot of the financial responsibility is on their back, and how do we give them information where they can make the choice that's in their best interests, they can maximize their benefits, they can see a provider, whether they choose to go into the office or now hopefully do it virtually going forward, and they can access other services outside of the provider that they think they need. Bringing that all together in a fragmented, highly regulated industry is one of the challenges that we all, I think, have to continue to deal with.
It's a good point. Chris, there's a question on here, and I don't know the right answer to it, but you may have a perspective. What does the panel think of the platforms in place at scale across Ping An, China? You may have heard of it. Discovery Health, Babylon, as they seem to have moved ahead so quickly. And Ping An's it's a terrific story, actually, a terrific case study. Are you on mute, Chris?
Probably. That one I haven't heard of. Well, China, obviously, but not the specific platform. I think that, in the US, we're slightly slow to adopt some of the technologies that we could, but often, and Vanita was talking about this earlier, platforms to us tend to be piece parted, right? There's a platform for everything, but not necessarily a central one. And even the central ones are central data platforms. And having more data isn't better if we can't use it. And we can't drive the interaction, as we're talking about. Putting the customer at the center of what we do, having the physician or the family health manager be at the center of the decision making and enabling them to get the services and support they need. But I think platforms that align these capabilities, as Benita was talking about, that allow us to get the right service, the right data out, are what we ultimately need, because we have too much, and this is maybe my own bias, but things are too complex, and that's not a bias, but I think a bias that I have is things like an app store are really difficult in healthcare, and because I'm adding more capabilities in front of somebody, but in my normal life, I'm doing one or two things at a time. I'm ordering food. I'm getting a table, right? I'm ordering Uber. I'm not doing all those things at the same time. And so if you think about a value-based arrangement, I've got incentives to improve Medicare Stars performance or quality and HEDIS. I'm trying to reduce total cost of care, and I'm trying to change the experience. I'm multidimensional in all cases. And so when I'm interacting with somebody, not only do I want to ride to the right provider, and I want to use my benefit to have it paid, and I know I can get home, and I want to know exactly what I have to do to prepare, so when I show up, I don't have the wrong form, or I didn't bring my scripts. And it's a multidimensional problem, and one app at a time doesn't work. And so on the whole, in the way that we're thinking about managing populations, and when you miss one opportunity, that one opportunity that we didn't include something is when the patient or the individual is readmitted. They go home, they didn't get the call, they needed activity of daily living support, and their cupboards were bare, and they needed some food. And the fact that they didn't have that, now we've got a care gap that we didn't find out till too late, and within 72 hours, they're readmitted. Simple things like social determinants. We know that we've done a functional assessment, but the data sat somewhere else. And so we didn't use the functional assessment information with what we knew about the individual and integrate those pieces. And the use of platforms can help, but it has to be, those platforms have to be used by the right people to be able to interact. And so anyway, that's a thought on that. So I don't know about the capability in China. I do know that all the major health plans are thinking about platforms, and we're all taking different approaches to it. Some are sort of big data. Let's apply AI and ML, and we'll find more insights. I would agree. While I think that's great, I think we have lots of insights that just aren't being used. And so everybody has a workflow. EMR is a workflow. Care management's a workflow. Practice management's a workflow. We have our own workflow. What do we do at home? How do we prepare our kids, every day before getting ready for school? So I think we have to figure out how we deliver that information, support, and service in the right place. Platforms can help, but we need these integration platforms that allow us to take these different interactions, between quality and service and support and experience, and meld them together, because I think we actually add complexity when we bring too much at one place. And I'll give you one last example. I know I've used military examples, but it's kind of interesting. So there's something that we have in the U.S. called Aurora Fighter. And Aurora Fighter collects 2,000 data points simultaneously. A person can only process about 14 data points. I can see altitude, I can see speed, I can see fuel. In healthcare, we try to give all those 2,000 data points and all the insights to somebody. If they have all this stuff, they'll be able to process it in their brain. What we have to get to is, I've got all these apps. I just need the key insight from each of those apps in front of me in my panel to know if I'm a care manager, or if I'm a social worker, or if I'm a community health worker. What are the pieces that I need for that interaction? And it's not all of it, right? It's role-based, all driven off the same platform. And I think each health plan, from CVS and Aetna to Anthem to United or Optum, are all approaching this in different ways. But I think that's one of the key things we're going to have to solve if we're going to get serious about both value-based care and being able to support our provider collaborations to be effective.
I come back to the point Chris was making, and this is the example you gave about China, and I don't know that particular example, but I think the realities of our system would suggest that we're never going to have this, someone called it, I guess, a platform at scale or a monolithic platform. I think interoperability is the more important point. You know, there are going to be a lot of companies that are developing fantastic tools and information, and it's how do we make sure that we're sharing that information in a timely way, in a way that, to Chris's point, providers and consumers can understand and not get overwhelmed by. I think part of this is the reality of our employer-sponsored health insurance system, and I'm not arguing for it or against it. It's just the reality that, you know, today you can be employed by company X and have Anthem, and you leave that company and go to company Y, and you have United, and that information isn't necessarily portable. And we have 4,000 hospitals, 900,000 physicians, and I think it's the interoperability piece where we can make a lot of progress so that we're sharing the right information across the ecosystem.
Yeah,
Mike, that's a great point. And, you know, we're not going to get into this today, but there is a role that the government or the regulation plays in terms of addressing some of the structural issues that the payer system doesn't talk to the provider system and the consumers is not connected. And obviously the laws of interoperability have been addressed. But one of the things that keeps spinning in my head is like, who's going to pay for all these things? You know, every payer is looking for a platform. Every provider wants to be able to leverage the EMR applications that they have, hoping and wondering that they could become open platform. And at the end of the day, the solution of standards, single patient ID, identity management, all of that, hopefully structurally somebody else would address so we can, you know, come out of that fragmentation. Vanita, you were trying to say something also.
I was just going to say, we can't forget in all of this complexity around interoperability that the source of truth is the consumer themselves. And the platform that wins is the one that the consumer uses. And it's that clear, right? If they lean in and they engage and they use it, that is kind of what we need to build off of. And that is what we need to center on when we're looking for interoperability. And what I would hope would happen is just like, you know, when you move insurance companies, typically as a payer, we try to make sure, or you know, you move from, you're in an employer setting and you're moving from one insurance company to the next. You want to maintain the network as much as possible, right? You don't, you know, as often as we can, we try to make sure people can keep their primary care physician through those transitions because that's important to them, right? They've got that therapeutic alliance and you want to keep that intact. I think we need to look at digital and the source of truth on the consumer in somewhat the same way, right? We really want to make the platforms that the consumers use and depend on part of the benefit that they can carry no matter what transitions in life they're going through, whether they are, you know, coming out of employer-sponsored insurance and going into Medicare, they really have the ability to continue using those tools that most matter to them. And that's kind of what I hope to see happen as we evolve benefit constructs and value-based care at the same time, is that these tools and the ones that are truly effective and loved, they persist and they last over the lifespan of a member.
You know, there's lots of questions on data and privacy out there that we're being asked on this panel, and how that information is managed, and ultimately who owns this record, is the consumer or the patient. Hopefully that's the former is the answer. Any final take on the shift and movement of big tech into health? You know, our CEO uses this word nowadays. She says, healthcare is everybody's business. And that's very true. There is no corporation out there, whether you're in financial services, coal mining, that you're not talking about healthcare. So, you know, we look at hundreds of digital health companies, which are all around care management, population health, engagement in health. You look at, you know, the big mags and the platform companies. What do you think is the future of you know, technology in care management in this, and how all of this will move? I mean, will the point solutions get acquired? Mike and Chris, Vanita, you guys have a point of view on that?
Yeah, I mean, I think, you know, the point solutions, I think, are going to be So
a lot of noise in the system.
yeah, I've always thought because of that noise, there'll be a shakeout. Many of the companies just won't survive. To the point, the consumer will choose the platforms that best meet their needs, and those that don't, I think, will go away. I think for the platforms that do best meet their needs, you'll see some of the incumbents, those with a lot of agency and control in the system, will acquire those platforms and try to integrate them in. So I think that's just the natural evolution. When the industry is in a state of flux like it is and in a state of consolidation, you'll see these great new emerging companies on the small end either thrive or fail. Those that thrive, I think, will end up probably getting acquired. And then you've got over the top the big giant global tech companies. I wouldn't put it beyond them. They've got a lot of capital to invest in this and a lot of brilliant people. I think they have struggled to really find their role in this at scale. The translation of their traditional loyalty of consumers hasn't always been one-to-one when it comes to healthcare. And so I think they'll also have to think about the role of the physician in their strategy, the role of the payer in their strategy, the role of other technology and service providers as well.
Vanita and Chris, any comments or thoughts on that? What Mike just shared?
I guess my comments would be that as we think and reimagine care management, we just need to hold a high bar on the introduction of digital. We really cannot accept the point solution approach because I think I commented on this earlier. A person is truly many things at the same time, and we don't need to. The technology is there that you don't need to build one solution for diabetes, a different solution for depression, yet a different one for sleep health. You really can pull these things together, and we need to hold a bar. In fact, we need to hold the bar to the point that it goes all the way down to the level of personalization for a member, right? We want to be able to say that a person who's facing diabetes, how do they arrange their, very Indian diet in a way that accommodates the level of carb intake that they need to take in the context of the cultural meals that they are used to eating, right? We want to get that clear, and we want to get that streamlined on impacting members, and we should hold the high bar on any of the tools and the platforms that we can, we consider adopting. Hold the bar on personalization, and we will get there.
I like that a lot because.
Oh, sorry, go ahead.
Go ahead.
No, you're good.
No.
Oh.
I was
just going to say, I might take just a different thought. And I agree with both Mike and Vanita. I think one of the things that we're missing in healthcare is actually, and this will sound controversial, but it's just management and execution. So we have lots of cool stuff. We have lots of great technology. We have lots of great doctors. We have great hospitals. We've got great services. We've got great benefits. The execution, though, when we say, how are we enabling the consumer to access those services and support when they need them and bringing them together to make it easy, that's where it falls down. We haven't said, how do we make this simple? How do we align multiple things at the same time? And so, when you think about value-based care as an example, alignment of payment and incentives, building a payer-provider collaboration that actually supports the customer, whether it's an employer, a government, state, or even CMS or an individual, and then align that with the benefits, product and plan design and marketing, even so much as the good housekeeping seal of approvals that we all provide. In any network directory I've ever seen, when I try to find a doctor, I look at all of the ones that I have options with, and then I look at all the ones that have the, quality bar, and I've only narrowed it down to 1,000 doctors. Well, now I figure out what's the closest one that I might be interested in, and maybe the school that they went to, which doesn't necessarily mean anything about their own quality, and I've got a problem. But the execution of taking a simple problem, like what are we trying to improve? If we're trying to orient the system around a consumer health, what do we bring to bear? What technology do we use? And then how do we organize that to create a simple system? Instead, and look, this is the way we're all brought up. the company runs on innovation. We've got a simple idea, like my grandmother fell and needed support. And now I can figure out through that little interaction, what is support does she need? And someone builds a company around that. And then you add and add and add. But that simplicity to say, what's the experience that we're trying to deliver? And then how do we orient this great technology, our doctors, our benefits, our networks around that? There's a lot of work to be done there. We give lip service to it. We've talked about it for over a decade with the triple aims. We spend a lot more time talking about quality and efficiency, or quality and cost, than we do how do we create the experience. And I think now more than ever, with people really in their homes, we've got to think about how do we engage them? How do we create an experience that's like when they use their normal phone to access these services and make it easy? So I think, that's one of our biggest opportunities going forward, is taking some of these right ideas and aligning them to address engagement and create better economics in healthcare. Because I think, as some of people have said, like, we've got data privacy issues and we've got platform issues and everything else, but when it all comes down to it, healthcare costs keep going up, and we're only getting older. And so we've got to do something. And walking into a provider's office, asking them for a massive discount in exchange and putting them at risk is only one piece. It's like, playing a game and only knowing how to run. If you can't catch and you can't do some of the other things, it's really difficult to win. It's about a team approach. And so I think if you apply that to healthcare, we've got to pull some of these pieces together to be more successful.
Hey, Chris, I would say your point is not at all controversial, because all you have to do is look at the facts, look at the trends, look at the costs. We are not, as a country, where we need to be. Our system, COVID has exposed that in a big way, but we all knew that before. That's why all of this innovation exists. And I think there's still so much work to be done here to simplify, align, and make sure that the financial incentives are encouraging the right behaviors.
So you guys kind of got into the future of care management. You're essentially saying, we got all the assets, we got the data, we got the technology, but the problem is execution. The problem is simplicity. The problem is standardization. So we got a few minutes left, 1 minute to each of you. If you had to put your most provocative point of view out there, paint for me and the public and the audience here, what's the future of care management 5 or 10 years from now? The more provocative, the better. There's tchotchkes at the end of this.
I would just say, let's not do the same thing we've been doing for the last decade, right? Let's really kind of change and broaden the focus. Let's think about the day-to-day lives of people and how we can support care in their day-to-day lives, and then embed that care support into the reimbursement system in a very different way than it's done today.
Mike?
Yeah, so I won't offer some grand forecast. I'd say the mistake that most people make when looking 5 or 10 years out is to draw a straight line from where things are today. And that doesn't create much positive change. It just establishes the negative trends that we already have. But I can guarantee you that, there will be organizations that we're not even aware of today that are going to do great work. There are going to be existing organizations that continue to get bigger and better at this. And really, there's no determinism in any of this. So it's up to each of us to make a difference in the way that we best know how.
Chris?
Yeah, I'd say it's time to get serious about putting the customer, whether it's a consumer or an employer or government, at the center of what we do. And then moving away from payer-provider collaboration being like ships passing in the night, where we're interacting with our members and they're interacting with patients, and we're sharing data and contracts between us. That using platforms and data and these kind of different applications and services that if we think about the experience we want to create and how we would collaborate together on a platform, so that what's being prescribed and what's being filled, we can complete that journey and understanding. And when we've got a gap, we know who's on point. Is the physician reaching out? Is our care manager reaching out? And we've got an operational path to align those things. I think we'll be in a better place, and we'll see quality continue to rise, but also not quality at any cost, quality at lower cost with a differentiated experience organized around our customer. And I think that's really important as we think about the future.
I love, love, love that. And on that note, thank you and happy holidays to everybody. Thanks for joining. And I'm going to hand it over to our organizers.
Thank you to Sonal and to all of our panelists. If you would like to continue the conversation, please join us on Twitter. And now, please welcome yoga instructor Emma Poole.
Hi, everybody. Welcome. I'm just going to tilt my camera there. Thank you all so much for being here. I know that you've all been sitting probably for a while. So if you're partaking right now, this is going to be about 15 minutes, and it's just meant to give you a little break in your day and a little bit of movement and breath in your body. So I would encourage you in the next couple of moments to find a seat on the ground. You don't have to have a yoga mat, but maybe a softer surface of the ground, and you can start and see what happens. And of course, this is entirely up to you how much or how little you do. So take a moment, I'll let you all get settled. And in the next couple of breaths, just let your hands find your lap. And I want you to close your eyes if you feel comfortable. And try to sit up a little bit taller, letting your shoulder blades soften down and back, and creating some awareness across your chest. So it feels like you're sitting up just slightly taller than maybe you normally would. Take a deep breath in through the nose. Open your mouth, exhale. Again, breathing in through the nose and through the mouth, breathing out. Let your lips close. Inhale through the nose as if the breath is lifting up into the crown of the head. And through your nose, exhale. And take that a couple more cycles on your own, just observing your breath and observing this force within you that is always present, but that we don't often think about very often because we don't have to. So as you start to come into your body and come into your presence, just become aware of your rib cage expanding as you inhale and contracting as you exhale. Notice any sounds that you hear right now, wherever you are. And then all together, take another deep breath in, lift your arms up over your head. And as you exhale, pull a prayer into your heart, connecting your palms to touch and letting your chest lift up into your thumbs. And we just take this gesture as a way to acknowledge, creating a little bit of a shift in our day, a little bit more intentions in our mind. Go ahead and release your hands to your lap. As you inhale, roll the shoulder blades up by the ears. As you exhale, roll them down and back. Again, breathing in, lift the shoulder blades up. Exhale, circling them down and back, just feeling any creakiness, any tightness. One more time. Inhale, lift the shoulders. And exhale, roll them down and back. Take a breath in. As you exhale, drop your left ear to your left shoulder and just notice any stretch along the right side of your neck. Move your chin to your chest. And as you breathe out, switch. Drop your right ear to your right shoulder. Breathing in. Breathing out. Again, chin to chest. Exhale, left ear, left shoulder. And chin to chest. Exhale, right ear to right shoulder. Pick your head back up, lift your arms up on a breath in. Exhale, take a twist to your left on your breath out. So tent your left fingerprints back behind you and let your right hand kind of cup that left kneecap. Maintain a connection to your seat as you inhale. So feel the area where your body touches the earth and lift the breath up into your spine. As you exhale, can you twist just a little bit deeper? Keeping your right arm where it is, reach that left arm up and start to side bend. And so as your left arm extends up and over to the right, create a little bit of resistance as you push your kneecap into the right hand. Another breath in here. Let your left hand release onto the opposite knee so your arms are crossed. Soften your chin into your chest, rounding your spine. And if you have a lot of tightness in your upper back and shoulders, as most of us do, you might feel some sensation happening. Next breath in, let your arms extend back up through center. And take your twist over to the right. So tenting your right fingerprints back behind you. And this time it's your left hand cupping that right kneecap. I tend to close my eyes pretty often when I practice, so I encourage you to do that. But if it's not your thing, just try to relax the muscles of your face. As you inhale, lengthening through your spine. And as you exhale, twisting just a little deeper. Keep your left hand where it is, send your right arm up, and take a side bend. And as you reach that right arm up and over to the left, push the kneecap into the opposite hand and start to feel the blooming open of the right waist. Take another inhale here. Soften that right hand to the opposite kneecap so your arms are crossed again. Push the kneecaps into the hands and try to drop the chin into the chest. Again, just breathing right into that space behind the heart. That area of the upper back and trapezius that gets super tight over time, especially as we're looking at devices these days. Good. And then one more time, inhale your arms up through center. And as you exhale, circle them back behind you. Put your fingertips on the earth behind you. Just start to sit up tall so it feels like you're pressing your hips forward. And then you have the option maybe to lift your hips up and let your head drop back. Deep breath in there. Sit down as you exhale. And we'll just gently shift forward onto all fours, hands and knees. So you'll place your palms underneath your shoulders and your knees right underneath your hips. As you inhale, tuck your toes, let your belly drop, and pull your heart forward. As you exhale, point your toes, round your spine, and push the ground away. So getting a little bit more suppleness here in our back body. Tuck your toes as you breathe in, pull your heart through, kind of tent the fingerprints. And exhale, point your toes, round your spine, and bring chin to chest. 2 more rounds together here. Inhale, opening your heart and just noticing what you feel, what feedback the body is giving you. Exhale, push down and round. One more time. Inhale to tuck your toes, open up your chest. And exhale to point your toes and round. Coming back to your neutral spine, walk your hands forward about a palm's distance. Retuck your toes if they're not. And very gently, keeping your knees bent, press your hips up and back into a downward facing dog. And you might feel a little bit creaky here, especially if you've been sitting for a while. So I would encourage you to just keep your knees bent. Let your neck relax fully. And try to keep pushing the ground away with your hands so that you feel something happening in your spine. You can feel just a little bit more length. Take a big breath in and exhale it out. Start to walk your feet to the top of your mat. Keep a lot of bend in your knees and let yourself hang. Catch a hold of your opposite elbows, just swaying here, rocking side to side, feeling the weight of your body unspool, the weight of your brain fall further into the front of your skull, the muscles of your jaw and your eyes, just let go. Big breath in, and then everything drops. Keep those knees bent, and vertebra by vertebra, begin to roll up to stand. Let your shoulder blades lift up, down, and back. Take that twice more. Inhale, the shoulders up. Exhale, down and back. One more time. Inhale, the shoulders up. And exhale them back. On your next breath in, lift your arms out and up. And as you exhale, micro bend your knees and cactus your arms. So I'm doing an intentional shoulder opening practice right now, just because when we don't have too much time, it can be a really effective way to get some energy moving and some blood flowing. So imagine that you're pulling the elbows back toward each other and you're just letting your heart extend. Option to take your hands behind you, interlace your fingers if you have the flexibility, and then perhaps stand up a little bit more and lean back, opening through your spine. Next breath in, sweep your arms out and up. Pull a prayer to your heart and let your arms fall by your side. We'll take just 2 standing sun salutations. Inhale, reach your arms up. Exhale, dive over your body with bent knees. Bring your hands to your shins, come to a flat back, lift the chest. And exhale, fold over your body. Again, inhale, push down, rise up. Bring a prayer to your heart as you exhale. One more like that. Inhale, reach the arms out and up. Exhale, folding forward like you're just diving into the earth. Come to fingerprints, hands on shins, flat back. And exhale, fold forward. Inhale all the way back up. And this time as you exhale, take your palms through you and right back down to the earth. Slowly stepping back into your downward facing dog to lift your hips. Inhale, lengthen your body forward into a push-up position. And as you exhale, lower your knees to the ground. Bring your knees about as wide as your mat. If you don't have a mat, a little wider than your hips. And just sit your tailbone back toward your heels into a child's pose. And we take a moment here to soften and to listen and just notice the breath moving through the body. Even if this is the only time all day that you have the consciousness of the breath moving through you, that is the beginning of mindfulness, is just the awareness that there is something happening. Take a deeper breath in and a deep breath out. Slowly roll yourself up to sit. Shift your hips out from underneath you. And then just once more, we'll find our seat. And I would ask that you take one hand on top of your heart, doesn't matter what, and the other hand face up on your thigh. If you feel comfortable to close your eyes again, close your eyes and just observe how you feel. You might notice that your heart is beating underneath the palm. Maybe you have slightly more clarity of breath or of body, and maybe you feel exactly the same, and that's fine. We're just observing. Take whatever hand is on your lap, put it on top of the hand on your heart, and we will finish practice with one deep breath. Inhaling here and exhaling. Thank you all so much. Have a beautiful rest of your day. Namaste.
Thank you, Emma, and thank you everyone for joining us today. Please
Thank you.
enjoy the holidays and have a great rest of your day.